I'm going to call the first speaker, Dr. Jose Kuzli. And this is a very special, near and dear to my heart, because I have the opportunity with Richard, Solidarity Bridge, and others in this room to work in Paraguay with Dr. Kuzli. And I thought this time around, he should tell the story, not me. It's not my story. It's him and his patients. And we also have Diego Servian, also a Paraguayan neurosurgeon. He is here. This is Dr. Kuzli's first time in the United States. So I will just say, this is how we are all the time. We hang out in rooms like this. America's a beautiful place. Thank you very much.
Thank you. Thank you. Good morning, everyone. I am Dr. Kuzli from Paraguay. I am very happy to be here, and it's an honor for me to be part of this symposium. To be in context, Paraguay is there in South America, between Argentina, Brazil, and Bolivia. We have, yes, a lot of problems, but the principal problem is the corruption and the impunity. And this brought to Paraguay poverty and inequality. Very simple. We call to this presentation how, with the small changes, global neurosurgery can have a great impact. And this is the hospital where I work, the National Hospital. This is the biggest hospital, public hospital in Paraguay. We perform there between 12 and 1,500 surgeries every year. And we have a lot of problems, yes, but we select one of these problems to have a possible solution. And we selected the AVMs, brain AVMs. Why? Because in 2018, we had 2 cases of brain AVM, but we operated only 4. Why? Lack of expertise, we don't have instrument, equipment, we don't have also embolizing agent. And how to improve? Maybe with a mentoring program in AVM surgery. This was our beautiful equipment in 2018, and this is not a part of equipment. This is all our equipment at this moment. This critical situation made me ask for help, but to whom? To these people, the people of Solidarity Bridge. At the head of this foundation is Dr. Richard Moser. And in a meeting with him, after sharing our situation, Dr. Moser said to me, "What exactly do you want for us?" And I say, "We need to improve our skills in AVM surgery." "Okay," he says, "but do you have mainfield?" I say no. "Do you have high-speed drill?" I say no. "Do you have neuroanesthesiology?" No. "Neuromonitoring?" No. "Micro lab training?" No, no, no. "Okay," he says, "and we can do it," and we make a plan. And this was our plan. We needed equipment and instruments. We created a neuro lab training. We needed a mentor in anesthesia and neuro ICU. And we needed a mentor in AVM surgery, a very good surgeon in AVM. And we will do it 1 month every 6 months for 2 years. This was our plan. Some months later, Solidarity Bridge and the University of Wisconsin donate us very good equipment. Mayfield, yes, in 2018, we already have a Mayfield. And the University of Wisconsin equipped us basic but very good lab training. In 2022, the government brought us a new microscope. And this moment I say, wow, now we can start our fellowship at home. And we started. We have three sessions between 2023 and 2024. In each session, we have surgeries, ABM surgeries, clinical meetings, neuroanesthesiologists, tips and tricks, equipment, lab training, and lectures in different societies. These were the 12 ABMs of our project. We have good results. We're learning a lot. Everything is good now. We lost one patient by pulmonary sepsis. Summarizing, this project, we have mentor surgeries in ABM. We created a microsurgery lab for all neurosurgery residents in Paraguay. We have microsurgery practice with tutors, cerebrovascular lectures. They donate us high-speed drill, endovascular devices, clips, mini clips, etc., etc., etc. Good, but do we improve really in something? Yes. Now I can say we are totally independent in ABM surgery. Of course, we are not the champions of brain ABM, but we improve 100% our skills. And we operate now 90% of the patient in a year. And this project had some positive side effects, okay? In brain aneurysms, look these graphics. In 2018, we operate only 42 cases in 1 year. Last year, in 2024, we operate 120 cases in 1 year. It may be the most important. Before 2018, we operate only 5% in acute period, after day bleeding. But now we operate 90% of these 120 cases in post-bleed day. Anesthesia, very good. Now we have a good anesthesia with young neuroanesthesiologists and resident of anesthesia. Microsurgery lab, good. We plan the seat. Young neurosurgeons and residents only reap the fruit. Endovascular, good, but all the devices were used in 1 year. We strongly believe that this kind of program can be replicated in other lower and middle-income countries, even in other neurosurgical fields like school-based, awake surgery, epilepsy, etc. Thank you.
Thank you, Dr. Kuzli, for that talk. Yes, I think we all understood it. And I want to mention that this concept of fellowship at home, I think, was a success because we had a champion like Dr. Kuzli in his place carrying